Stop scrolling for 10 seconds because one everyday habit I see in my senior patients is silently enlarging their prostate, worsening nighttime urination, and accelerating symptoms most men think are just normal aging. Now, let me ask you something important, and I want you to answer honestly in the comments below. Have you ever been told your prostate issues are just part of getting older and that nothing you do really changes the outcome? I'm speaking to you today not just as a doctor, but as someone who has sat across from thousands of men who felt confused, embarrassed, and even afraid about what was happening to their bodies. I want you to hear this clearly from the start. You are not broken, and this is not something you have to quietly accept. Understanding the cause gives you power, and today I'm warning you about one habit that I see making prostate enlargement worse again and again. Part 1 begins with something most seniors never suspect, because it feels harmless and normal. The habit I'm talking about is prolonged sitting combined with low daily movement, especially when it becomes your default lifestyle. I know that might surprise you, because no one ever warned you that sitting could affect your prostate. But when you sit for long periods, blood flow to the pelvic region slows, pressure increases around the prostate, and inflammation quietly builds. I've had men tell me, "Doctor, I eat well and I take my medication, so why are my symptoms getting worse?" When I ask about their daily routine, I hear the same story. Hours in a chair, long stretches without standing, and very little intentional movement. Over time, this creates congestion in the pelvic area, and the prostate is right in the middle of it. That congestion doesn't cause problems overnight, but month after month, year after year, it adds up. Now, let me be very clear and responsible here. Sitting alone does not cause prostate disease, and I am not saying it is the only factor. Prostate enlargement is influenced by age, hormones, genetics, and overall health. But what I am warning you about is how this habit acts like fuel on a slow-burning fire that is already there. Think about it this way. Your prostate relies on healthy circulation to clear inflammation and metabolic waste. When movement is limited, circulation suffers, and the prostate becomes more vulnerable to swelling. That swelling can worsen urinary symptoms like weak stream, frequent nighttime urination, and the constant feeling that your bladder never fully empties. I've watched men dismiss these symptoms for years because they didn't want to make a fuss. They told themselves, it's just age, or other men have it worse. But here's what I want you to understand. Early awareness gives you more options, more comfort, and more control. You don't have to wait until symptoms dominate your life. Here's something else many men don't realize. Sitting for long periods also affects insulin sensitivity, weight distribution, and inflammation levels throughout the body. And chronic, low-grade inflammation is one of the factors researchers continue to study in relation to prostate health. Again, not a promise, not a cure, but a meaningful piece of the puzzle. Let me share a brief story without names. A man in his early 70s came to see me, frustrated and exhausted from waking up 4 times a night to urinate. His tests were stable, his medications were appropriate, but his lifestyle told a different story. When we focused on breaking up long sitting periods and restoring gentle daily movement, his symptoms gradually became more manageable. That's the message of part 2, and it's one I want you to hear without fear or pressure. You don't need extreme workouts or painful routines to support your prostate. What matters is consistency and circulation. Standing up every 30 to 40 minutes, walking for 5 to 10 minutes after meals, and keeping the pelvic area active can make a real difference over time. If you're thinking, "Doctor, I have joint pain or limited mobility," I hear you. This is not about punishment or pushing through pain. Even seated leg movements, slow indoor walking, or light stretching can support blood flow. The goal is to reduce stagnation, not to become an athlete. Here's a simple question for you to reflect on. How many hours yesterday did you spend sitting without interruption? Most men underestimate this, and awareness is the first step toward change. I often tell my patients that the body responds better to small daily signals than occasional big efforts. Another habit closely connected to sitting is holding urine for long periods. Many men delay bathroom breaks out of habit or convenience, especially when they're seated for long stretches. Over time, this can increase bladder pressure and worsen urinary symptoms associated with prostate enlargement. Listening to your body matters more than convenience. Part 3 is where I want to encourage you, not warn you. Prostate health is not just about what you avoid, it's about what you support. Hydration, balanced nutrition, regular checkups, and movement all work together. No single habit controls your destiny, but daily choices absolutely influence your comfort and quality of life. If you're already experiencing symptoms, please hear this clearly. You are not late, and you are not failing. Many men see improvement in symptom management when they combine medical guidance with lifestyle awareness. Always talk with your healthcare provider before making changes, especially if you're on medication. I also want to address the emotional side of this because it matters. Prostate issues can quietly affect confidence, sleep, and intimacy, and many men suffer in silence. You deserve clear information and respectful care, not shame or dismissal. Talking about this is not weakness, it's wisdom. As we wrap this up, I want you to remember one thing. Aging does not mean surrendering control over your body. Awareness gives you leverage, and small habits repeated daily can support better outcomes over time. Your prostate is not your enemy. It's a part of you asking for better support. If this message helped you understand something new, I encourage you to share your thoughts or experiences in the comments. Your voice may help another man feel less alone. And if you want more clear, honest guidance about prostate health, stay connected here, because your health is worth protecting at every age. Now let me slow this down for a moment, because this is where many seniors misunderstand what I'm saying. I am not asking you to fear your chair, your couch, or your favorite place to relax. Rest is important, and your body deserves comfort. What I am warning you about is when stillness becomes your default state for most of the day. Your prostate, like every organ, responds to signals. Movement is one of the strongest signals you can give your body that things should flow, drain, and reset. When those signals disappear, the body adapts in ways that are not always helpful. This is especially true as testosterone levels change with age, and the prostate becomes more sensitive to inflammatory triggers. Many men ask me, "Doctor, why didn't anyone tell me this earlier?" And the honest answer is that medicine often focuses on treatment after symptoms appear, not daily habits before they worsen. That's not because doctors don't care. It's because lifestyle conversations take time, and many men never bring these concerns up until they're already uncomfortable. But today, you and I are having that conversation. Another layer of this habit involves posture. Slouching for long periods compresses the pelvic region even more, placing added pressure on the bladder and prostate. Over time, this can worsen urgency and discomfort. Sitting upright, with your feet flat and your pelvis supported, is a small adjustment that many men find surprisingly helpful. Let me ask you something personal. And again, feel free to reflect or comment below. When was the last time you stood up just for your health, not because you had to? That moment of intention matters more than you might think. Health improves when care becomes conscious. Now I want to touch on something sensitive but important. Nighttime urination is one of the most common complaints I hear from seniors with enlarged prostates. While many factors contribute, prolonged sitting during the day, followed by inactivity in the evening, can make nighttime symptoms worse. Gentle movement earlier in the day often leads to more restful nights. I've had patients tell me they were shocked that something so simple made a noticeable difference. Not cured, not erased, but improved enough to sleep longer and feel more human again. And when sleep improves, everything improves: energy, mood, patience, and even pain tolerance. This is how small habits ripple outward. Let's talk briefly about circulation, because it's central to prostate health. Blood carries oxygen and nutrients, but it also removes waste and inflammatory byproducts. When circulation slows, cleanup slows. Movement is your body's natural cleaning system. This doesn't require equipment or gym memberships. Walking, standing stretches, light household tasks, or even pacing during phone calls all count. The body doesn't measure effort, it responds to frequency. That's good news, especially if you've been sedentary for a long time. I want to pause here and offer reassurance. If you're listening to this and feeling a little regret, please don't. Regret does nothing for healing. The body is remarkably responsive, even later in life. What matters is what you choose to do next, not what you didn't do before. Now, let's address medications briefly, because this is a medical channel and honesty matters. If you're on medication for benign prostatic hyperplasia, movement does not replace your treatment. It complements it. Never stop or adjust medication without speaking to your healthcare provider. What movement can do is support symptom management and improve how your body responds overall. Think of it as improving the terrain, not fighting the disease. Better terrain often leads to better outcomes. I also encourage men to pay attention to hydration timing. Many seniors limit water intake because they fear frequent urination. While understandable, dehydration can irritate the bladder and worsen urgency. Spreading hydration evenly earlier in the day, combined with movement, often helps more than restriction. Let me share another brief observation from my practice. Men who feel empowered about their health tend to report less distress from symptoms, even when the physical findings are similar. Knowledge reduces fear, and fear amplifies discomfort. That's why conversations like this matter. If you're still with me, that tells me something important. It tells me you care about your quality of life. And caring is the first step toward change. You don't need perfection. You need awareness and consistency. Before we close, I want to leave you with a simple challenge. For the next 7 days, break up your sitting time intentionally. Stand, stretch, or walk briefly every half hour when possible. Notice how your body responds, without judgment or expectation. And finally, if this message resonated with you, I invite you to stay connected here. We talk openly, responsibly, and respectfully about men's health, without fear, without hype, and without false promises. Your health deserves clarity, dignity, and care.